Arresting the undercover sniper, a 16-year-old female presented with recurrent anterior uveitis, treated with multiple courses of topical and oral steroids. Her best corrected visual acuity was 6.6 in both eyes. The intraocular pressures were normal. Slit lamp examination showed a corneal scar in the right eye, 1+ cells in the anterior chamber, a normal pupil size and reaction, and a clear lens. There was slight elevation of the iris adjacent to the angle at 6 o'clock position. Dilated fundus examination was normal. The patient denied any history of trauma on repeated questioning. The slit lamp photograph showed a corneal scar. The anterior segment OCT showed a linear hyperreflectivity with marked shadowing within the iris. Ultrasound biomicroscopy showed hyperechoic foreign body with back shadowing. Dilated fundus examination was normal. Foreign body removal was undertaken under subtenon anesthesia. The pupil was myosed with intracameral pilocarpine. Anterior chamber maintainer was placed. A site adjacent to the foreign body was chosen. Microforceps were used to approach the foreign body. The incision was enlarged. Multiple instruments were used to approach the foreign body. A peripheral iridectomy was attempted. Finally, an incision at a different site was made. Since the foreign body was embedded in the posterior surface of the iris, microforceps were used to rotate the foreign body into the anterior chamber. Microscissors were used to cut the attachments to the iris. The foreign body had been embedded in the iris for almost 2.5 years. Finally, the foreign body was freed from the iris. Microforceps were used to bring it into the anterior chamber. Due to the size of the foreign body, the incision was enlarged, and foreign body forceps were used to remove the foreign body in toto. The incisions were sutured, and the anterior chamber was formed. On forensic examination, the 2 mm foreign body was found to be a stone. 1 week post-operative slit lamp photo and anterior segment OCT showed the defect in the iris. Why this case? Anterior segment foreign body constitute 15% of all intraocular foreign bodies. Posterior chamber foreign bodies are rare. By far, most intraocular foreign bodies are metallic. Non-metallic foreign bodies have lower speed and tend to remain in the anterior chamber. Like in our case, about 1/5 patients do not experience any pain and they deny history of trauma. However, missed intraocular foreign bodies constitute about 56% of trauma-related claims. Foreign bodies may sometimes be missed on radiography. Even in our case, the location of the foreign body was not accurately mentioned in the CT scan. Anterior segment OCT is a useful non-contact radiation-free technology for evaluation of anterior segment foreign bodies. In cases of atypical uveitis in the presence of a corneal scar, a suspicion of foreign body should be present even in the absence of a history of trauma. Thank you.